Good afternoon, everyone. Thank you for joining us today. It is January 24th. This is our first subcommittee budget hearing of the year. So welcome to our wonderful guests who have joined us. My name is Emily Shetty. I'm the chair of the subcommittee, joined by our new vice chair, Delegate Dana Jones. We also have new subcommittee counsel Joe, who's amazing and delightful to work with. And so we're just going to go ahead and dig in. So today we're going to be doing an overview of the DHS budget request for FY25, and we will begin, as we always do, with our DLS analysis. And I will turn it to analyst Sam Quist.
Thank you, Chair Shetty, members of the committee. Good afternoon. My name is Sam Quist from the Department of Legislative Services, and also joining me from DLS are Tanya Zimmerman and Natalie Andrade, presenting the overview analysis for the Department of Human Services and here to answer any questions. I'm going to begin with the first graph on page 2 of the report. This is showing a overview of the budget by fund source. The fiscal 2025 allowance for DHS totals $4.1 billion, which is a slight decrease of about $3.6 million overall compared to the fiscal 2024 working appropriation. This equates to about a 0.1% overall decrease. In the first chart on page 2, this is showing that the majority of the DHS budget comes from federal funds, the largest component of which are federal funds from the Supplemental Nutrition Assistance Program, which are broken out in the orange portion of the bar graph. The green portion is federal funds from other sources, and then there's a small portion on the top of the bars, which are Federal Electronic Benefits Program funds. The next chart on page 3, the pie chart, gives a breakdown of the DHS budget by function. As you can see, over half of the budget, about $2.4 billion in total, funds public assistance payments. These include SNAP, temporary cash assistance, and other public assistance programs. About $631.7 million of the budget funds the agency's personnel, and the third largest category is $350 million for the foster care maintenance payments program. The remainder of the budget funds the operating expenses and other programmatic expenses for the individual administrations within DHS. The chart on page 4 provides a more high-level overview of the budget by for all funds in the budget. As mentioned previously, the total budget equates to $4.1 billion. This chart breaks out federal SNAP program benefits and federal EBT benefits on the bottom lines. You can see in total federal funds from those two sources total about $2.1 billion, while the remainder of the DHS budget totals just over $2 billion. So there's about a 50-50 split there in funding. By fund total, general funds in the DHS budget total about $910.7 million, which is a decrease of about $5.6 million. Special funds total $166.1 million, which decreased by $19 million approximately. Other federal funds outside of the SNAP and the EBT program equate to about $900.4 million, which increased by $25.1 million, and the reimbursable funds equal $31.7 million, which is a decrease of about $22.6 million. By area of the budget, the largest amounts of funding go to the Social Services Administration and the Family Investment Administration. Turning to the next page, page 5 is providing a similar overview focusing on the general funds in the budget. So as mentioned previously, general funds total $910.7 million, an increase by $5.6 million in total. The majority of general funds in the DHS budget are under the Social Services Administration, about $476 million in total. the majority of which fund the general fund portion of the foster care maintenance payments program. General fund increases in the budget. The largest is under the Family Investment Administration. These increases are partially offset by decreases in the Social Services Administration, Office of Home Energy Programs, and the DHS administration. The following page, page 6, provides additional details on deficiency appropriations for fiscal 2024 that are included in the budget. In total, there are $125.9 million in deficiency appropriations, which include $64.5 million in general funds among these deficiencies. The largest deficiency appropriation is $72 million for the MD Think system maintenance and improvements for ongoing costs associated with that IT system in fiscal 2024. The second largest deficiency is $28.4 million in general funds for the foster care maintenance payments program to support changes in placement costs and caseloads compared to what was originally budgeted. The remainder of the deficiencies are for a variety of operating and programmatic cost increases. There are also two deficiencies that relate to caseload changes within Family Investment Administration. There's a $5.4 million increase to support increased temporary cash assistance caseloads compared to what was originally in the budget. And there was also a negative deficiency of $3.4 million to account for decreased caseloads in the temporary disability assistance payment program. Beginning on page number 7 and continuing on to page number 8 are the details of the proposed budget changes in the fiscal 2025 budget. Beginning on the top with personnel, the largest change in personnel is a $33.4 million increase for salary increases and associated fringe benefits, which account for the fiscal 2024 centrally budgeted cost of living adjustment and increments. This amount increase in fiscal 2025 represents that the fiscal 2025 budget accounts for the impacts of the 2024 centrally budgeted cost of living adjustment, while the fiscal 2024 budget currently includes those in the state account and does not allocate those among state agency budgets at this time. There's also a $19 million increase in agency-wide funding to support the filling of vacant positions, as well as aligning overtime and contractual employee spending with recent experience. The largest decrease under personnel is $6.1 million, reflective of an increased budgeted turnover rate in several areas within DHS. Under the assistance payments program, the largest increase is $69 million for the new federal summer EBT program, which begins in the summer of 2025, calendar 2024, beginning in fiscal 2025. There's also a $19.8 million increase for the EBT fraud replacement costs, in part due to changes in the availability of federal funds for that purpose. There's a $5.6 million increase for the state summer SNAP for children program, and a $2.3 million increase for the temporary disability assistance program. The remainder of assistance payments program changes outlined in this chart are decreases. There are several changes decreasing funding to align more closely with recent actual experience, including in the areas of the Transitional Support Services Program, the Emergency Assistance Program, Public Assistance to Adults, the Child Support Pass-Through, and then there are two decreases in funding relative to lower caseloads estimated in the fiscal 2025 budget, including a decrease of $13.7 million for temporary cash assistance and $61.8 million for the SNAP program. Under the Family Investment Administration, there's a $12.6 million increase in federal funds for the Maryland Office of Refugees and Asylees contracts. And there's also a $12.3 million increase for department-wide call center expenditures. And there's the third largest increase in FIA is a $10.2 million increase for contracts for food banks due to a change in funding previously budgeted in the dedicated purpose account for that purpose. Next, I'm going to move on to the Social Services Administration. There are a few smaller changes related to administrative expenses in that area, including for contractual services for the Baltimore City Child Welfare Services Department, as well as the Office of Administrative Hearings for Child Protective Services hearings more broadly. And there's a $700,000 decrease related to one-time legislative additions in the fiscal 2024 budget for child welfare services programming. The foster care maintenance payments program overall increases by $6.1 million in fiscal 2025 due to changes in estimated caseloads as well as placement costs. The Child Support Administration, there are an increase of $2.6 million for cooperative reimbursements for agreements with units of local government, and a nearly $1 million decrease for research and technical assistance contracts with the University of Maryland. In the Office of Home Energy Programs, there is a $4.4 million increase for administrative contacts with local administering agencies, as well as 3 decreases representing changes in special and federal funds for energy assistance programs. These include a $3.6 million decrease in federal low-income home water assistance funds, which were funded through federal stimulus legislation through the pandemic and are no longer available. A $5 million decrease in special funds from the Strategic Energy Investment Fund allocated for energy assistance, and a $10 million decrease in federal low-income home energy assistance program funding due to the funding allocation to Maryland for that program. Under information technology, there's a $7.5 million increase for the EBT payment processing and information system and contracts, a $2.5 million increase for the centrally budgeted DO-IT Department of Information Technology services allocation. And then the third change in that area is a $63.9 million decrease for the MD Think IT system and contracts, which represents the difference between the increase in funding in FY 2024 from the $72 million deficiency appropriation I previously mentioned and the amount budgeted in FY 25 for that purpose. Lastly, for other miscellaneous changes, there's about a $6.4 million decrease for agency-wide communications expenses, $7.8 million decrease for rent. The Montgomery County block grant, which I'll mention more in a moment, decreases by $13 million, and there are a $13.9 million decrease for costs related to the relocation of the DHS headquarters. Additional discussion about the change in the Montgomery block grant is discussed on page 9 of the analysis. Due to the structure of a state statute, Montgomery County receives a block grant in order to operate human services programming instead of operating as a local department such as in other jurisdictions. Funding that this block grant supports include funding for social services, family investment services, as well as other administrative services. The $13 million decrease in the budget in FY 2025 is larger than has occurred in prior fiscal years and results in a funding level that's comparably lower than in prior fiscal years, especially due to the fact that there's noticeable centrally budgeted salary increases for state employees planned for FY 24 and 25. So on page 9 of the analysis, we're asking the department to comment on some of the main reasons for this decrease in funding for that block grant. Turning to page number 10 of the analysis, this is showing a summary of some of the caseload changes for portions of the DHS budget that are based on caseload assumptions. The first portion for cash assistance, the temporary cash assistance caseloads are estimated to decrease by 8%. Corresponding to that, the TCA transitional benefit is increasing by about 53%, although there's a comparatively lower number of overall caseloads for that program. The temporary disability assistance payment program caseloads are estimated to increase by 6%. The SNAP supplemental benefits are estimated to remain at the same levels, and federal SNAP cases are estimated to grow by 3%. Under child welfare, the foster care placement percentage is estimated to continue to decrease by 2% in fiscal 2025, and the subsidized adoptions and guardianship portion is estimated to decrease by 1%. And then lastly, there is an estimate for child support collections. Child support collections in the fiscal 2025 budget are estimated to grow by approximately 5% in total. The chart on page 11 of the analysis shows a summary of personnel detail. In total, the fiscal 2025 budget includes no net changes in regular or contractual personnel. I'm going to turn now to the issues section of the report. There are 4 main issues that are included for discussion in the analysis. The first issue, which I'll cover, is related to personnel and personnel vacancies, as well as recruitment and retention efforts by the department. The first chart in this section, exhibit number 1 on page number 13, is showing the percentage of filled regular positions compared to the total positions that are authorized in the department. So as background for this data, the Department of Human Services has had elevated levels of personnel vacancies and risk in recent years. However, the most recent statewide personnel data available as of December 1st, 2023 shows that was a 5% overall decline in the department-wide vacancy rate over the past year, from approximately 14.9% in 2022 to 9.9% in December of 2023. As shown in Exhibit 1, this equates to about 90.9% of total positions that are filled positions, and the change year over year equates to about 306 more filled positions at the end of 2023 than compared to the previous year. Of the individual administrations within DHS, the Family Investment Administration had the highest percentage of positions filled at approximately 92.6%, while the Social Services Administration had the lowest at about 87.5%. The Family Investment Administration had the largest increase year over year in filled positions. On the next page, exhibit number 2 is providing vacancy data broken down by the length of time that vacant positions have remained vacant. So in total, as of December 1st, there were 592.28 vacant positions. Approximately 32.3% of these positions, or 191.23, had been vacant for over 1 year. And for short-term vacancies, 44% in total, or 265.8 in total, have been vacant for 6 months or less. You can see on Exhibit 2 also that the largest number of vacancies overall are within the Social Services Administration. The Social Services Administration also had the highest percentage of the total long-term vacancies for vacancies over 1 year. Exhibit 3 on page 15 is presenting data that was provided by DHS on the individual position classifications that had the highest percentage of vacancies within that position classification. DHS was requested to submit a report on personnel recruitment and retention strategies, as well as the outcome of those strategies. This data is some of the data that was included in that report, which was submitted to the budget committees in December. Among the position classifications with the highest vacancy rates, the caseworker specialist family services position was the individual classification with the highest percentage of positions vacant at 26.9%. That position, as well as the family services caseworker trainee position, are both social worker positions within the Social Services Administration, which, as previously mentioned, has the highest vacancy rate among DHS administrations. The other position classifications with high vacancy percentages include Child Support Specialist 1 and Child Support Specialist trainee positions, as well as the Family Investment Specialist position. Exhibit 4 on page 16 presents data that DHS also reported in their report. This is showing a comparison of the salary ranges for those positions mentioned in Exhibit 3 and a comparison of those salary ranges to salary ranges for similar positions in Delaware, Pennsylvania, and Virginia. Due to this comparison, you can see that there are some differences between the states. Starting salaries for the 5 DHS positions are comparatively higher to positions in the other 3 states. For all positions outside of 3 positions in the state of Pennsylvania. However, the upper limit of salaries for DHS positions varies. Comparatively, the upper limit for salaries for positions in Pennsylvania was higher for 4 out of 5 positions compared to DHS positions, and the upper limit for salaries in Virginia was higher for 1 position outside of 5. For all 5 positions in the state of Delaware, the starting salary and the upper limit to the salary was lower than compared to the DHS positions. DHS notes that specifically in the state of Virginia and Pennsylvania, there are different requirements for working as a social worker in those states that also impact salary comparisons to some extent. The remainder of this section of the report goes over the DHS department-wide recruitment strategy and activities that DHS conducted related to recruitment in calendar 2023. DHS previously submitted a report to the budget committees in December 2022 that initially laid out a department-wide recruitment strategy. The report that was submitted in 2023 provides an update on this previous strategy. Some of the components are comparative to strategies recommended by DBM in the Task Force on the Modernization of State Personnel Management System, which was led during the 2023 interim. Strategies specifically identified by the Department of Human Services include removing barriers to entry to deepen the pool of candidates. DHS notes that in some positions, specifically in family investment and child support, they were able to revise and revisit some minimum education requirements and other barriers. Streamlining the recruitment process in order to make the recruitment process more efficient. Marketing the department as an employer of choice in order to build the reputation as a desirable employer, focusing on competitive compensation and building a work environment that is both positive for employee well-being as well as meeting the needs of the department. DHS outlines that during calendar 2023, they were involved in several both in-person and virtual recruitment activities, as well as working with DBM to be able to be approved for offering on-the-spot job opportunities in some instances. I'm now going to turn it over to Tanya Zimmerman, who's going to be covering the update on temporary assistance for needy families.
Thanks. This issue begins on page 18 of the analysis. The temporary assistance for needy families is the primary federal fund support for cash assistance. Under federal law, the use of TANF must meet 4 purposes, which are outlined on that page, including providing assistance to needy families, reducing the dependence of needy families by promoting job preparation, work, and marriage, preventing and reducing out-of-wedlock pregnancies, and encouraging the formation and maintenance of 2-parent families. The funding through the TANF program is primarily through a block grant, which is largely unchanged since the program's initiation. Since fiscal 2017, Maryland has annually received about $228 million from the block grant. Maryland has also received TANF contingency funds in each year since the Great Recession. Contingency funds are available to states meeting certain criteria related to the SNAP participation or unemployment. Those conditions are in the bullets there at the bottom of that page. The state continues to qualify under the second condition, which is a SNAP caseload that's 10% higher than a corresponding period in 1994 or 95. And as long as the criteria remains unchanged, the state should continue to qualify for these funds. The state received about $27 million of these funds in fiscal 2023 and expects to receive the same level in 24 and 25. Beginning on page 19, there's a discussion of the TANF balance, but if you turn to Exhibit 5 on page 20, this shows the information related to the balance. The balance at the close of fiscal 22 was $63.5 million, which is about $23 million higher than fiscal 2019. That's primarily due to the use of funds available through the American Rescue Plan Act of about $140 million to over fiscal 2021 and 2022 to reduce TANF spending to allow those funds to be saved for future use when general funds were less plentiful. So while it was a higher balance than fiscal 2019, it was lower than was expected when that plan that was initially enacted due to increased spending from TANF than was originally expected. The closing balance of in fiscal 23 was $47.2 million, which is about $16 million lower than fiscal 2022. This was a larger decrease than was expected during the 23 session, and it came at a time when general funds were generally plentiful in the state. The use of fund balance in these years reduces their availability in years when general funds are less available. The projected closing fund balance in fiscal 2025 is about $36 million due to increased spending levels in fiscal 2025. Exhibit 6 on page 21 highlights the different areas of spending of TANF as well as comparison between years. The lower fund balance at the end of fiscal 23 compared to what was expected in 24 during the 23 session was due to increased spending of about $5.4 million compared to what was anticipated during the session last year. The largest area of increase was in child welfare services, an increase of about $13.5 million. There was also an increase of about $8.5 million for the local family investment program, which is the program where the caseworkers are budgeted. These were partially offset by decreases in cash assistance and the work opportunities program, which is where the work programs for TANF are budgeted. The fiscal 2025 allowance increases spending overall from TANF by about $17 million. The largest increase is in foster care maintenance payments of an increase of $18 million at $34.7 million. This would be the second highest in recent history. Local family investment program spending also increases. The work opportunities spending continues to decline by about $4.5 million. Although a decrease from 24, it would be higher than the 23 expenditure, but the 23 expenditure was the lowest level since at least fiscal 2011. Exhibit 7 on page 22 shows information about the share of TANF spending for cash assistance. You can see that it's generally above 40%. It's the largest use of TANF. with the exception of kind of fiscal 2021 and 2022, where the state intentionally reduced spending using the state fiscal recovery funds. Exhibit 8, however, highlights the uses of spending of TANF on child welfare purposes and how that has grown in recent years. Since fiscal 2020, DHS has spent more than $30 million on child welfare services in each year, compared to less than $20 million in the 4 years prior to that. DHS last year indicated the increased use of the spending for these purposes is due to declining attainment and other fund sources, particularly the Title IV-E program, which is the primary federal fund source for child welfare and foster care. With these higher child welfare spending levels, the budget has generally come in low with lower levels, and then it's increased at closeout, what was reported. So the final fiscal 2022 and 23 levels of $41.5 million and $37.7 million are compared to what was believed in the prior session and the working appropriation of slightly less than $25 million. This poses some risks to the balance that was shown earlier in the issue because the fiscal 24 and 25 budgets also contain this lower level of child welfare services spending. Similarly, the foster care maintenance payment spending has also increased from TANF. In fiscal 2025, it was less than $7 million compared to more than $30 million in each fiscal 2020 through 2023. And it also exceeds $30 million in the fiscal 2025 allowance. In fiscal 2015, these programs combined to represent 9.3% of TANF spending, but it exceeded 25% in fiscal 21 through 25. The state's required to meet maintenance of effort to continue to receive the block grant. The state has more than exceeded the amount that was required. The majority of the maintenance of effort spending is claimed related to the earned income tax credit and at both the state and the local level. Other significant contributors in fiscal 23 are the pre-kindergartner program and cash assistance. In October 23, the U.S. Department of Health and Human Services Administration for Children and Families issued a notice of proposed rulemaking that would make a number of changes to the uses of spending, the allowable uses of spending. ACF noted that they noted that states had shifted away from spending on cash assistance and employment-related spending, and that they were using the dollars on higher income levels up to 400% of the federal poverty level, and on purposes that viewed as tenuously connected to TANF's for purposes. The major changes that would occur under the proposed rulemaking are outlined in the bullets on pages 24 and the top of 25. The two that would primarily potentially affect the department are the first two, which is establishing a maximum income for the state definition of needy at 200% of the federal poverty level, and establishing in regulation a standard for determining acceptable uses of funds. The notice of proposed rulemaking doesn't expressly state the things that would be allowed or disallowed under uses of funds for each of the purpose, but provided examples of things that would be considered likely allowed versus likely not allowed, which are shown in Exhibit 9 on pages 25 and 26. I'm going to just focus on the first one, which is related to the purpose for providing assistance to needy families. Some of the likely not allowed categories it listed were foster care or other out-of-home maintenance payments and child protection investigations. The department reports that it's opposed to the three proposed regulation changes and that the change to the limit of the definition of needy families would impact spending and the claiming of maintenance of effort. Particularly, they used for some programs a definition of 300% of the federal poverty. They noted this in particular related to child welfare, transitional benefits, and pre-kindergarten programs, which is only part of the MOE claiming they do not spend state dollar or TANF dollars outside of DHS. As shown in Exhibit 8 earlier, DHS has increased their use of spending of TANF on child welfare services and foster care maintenance payments in recent years. And so in from fiscal 2021 and through 2023, they spent more than $70 million combined on these. Particularly, the department reports that it uses these funds for adoption and guardianship subsidies, as well as child welfare caseworker services related to in-home services. DLS is concerned that not all of the spending in this area would meet the reasonable test that ACF has proposed, and the impacts of that would be a potential penalty if they determine that it was a misuse of funds, and that other sources of funds would then be required in addition to the penalty to replace the spending currently being made. DLS notes that one solution to reduce risk would be to shift more of the TANF spending currently budgeted outside of TCA into that program when free up the general funds currently budgeted in that to support those child welfare services and foster care maintenance payments. A recommendation related to this will appear in the Family Investment Administration analysis. We've also asked the department to discuss the status of the proposed rulemaking, including the time frame and any impacts expected related to the proposed rulemaking. And I'll turn it back over to Sam.
Thank you, Tanya. The third issue in the report is related to hospital stays and hospital overstays for children and youth in the care of DHS. Hospital overstays occur due to difficulties in securing placement of children with complex behavioral health needs, which result in children remaining in hospitals or emergency rooms for periods longer than is medically necessary while awaiting appropriate placement. This has been an issue that has been ongoing in Maryland for several years, and in previous years, the General Assembly has requested and DHS has provided data on hospital stays and length of hospital stays in order to track the extent of this issue. The first item in the most recent report submitted by DHS is the number of emergency room visits and the length of stay for emergency room visits. This is shown in exhibit number 10 on page number 29 of the report. The current reporting period, which was from October 2022 to September 2023, there were a total of 205 children who were admitted to emergency room visits for psychiatric evaluation. This comparatively to the previous period of reporting, which spanned from October 2021 to September 2022. This was an increase of about 55 children who visited emergency rooms. By month, the average length of stay for these emergency room visits was approximately 8.4 days compared to an average length of stay of 6.9 days in the previous reporting period. By month, there was some variation. For all emergency visits, they ranged from a low of 2.7 days to a high of 24 days. The next chart on page 30, exhibit number 11, is showing similar data for hospital stays for children who were admitted into hospitals for both medical and psychiatric reasons. During the current reporting period, there were a total of 159 medical hospitalizations and 196 psychiatric hospitalizations, which is a higher number of hospitalizations compared to the previous reporting period, an increase of approximately 29 medical hospitalizations and approximately 36 psychiatric hospitalizations compared to the prior year reporting period. As far as average length of stay shown in Exhibit 11, for medical hospitalizations, the average length of stay was 20.1 days, which was compared to the prior reporting period. The prior reporting period average was 32.4 days, so there was a slight decrease in the average length of stay for medical hospitalizations. Similarly, for psychiatric hospitalizations, the average in the current reporting period was 27.6 days, compared to 33.7 days in the prior reporting period. Exhibit 12 on page 31 specifically looks at medical and hospital stays that were deemed longer than medically necessary. In total, there were about 99 children who were identified as experiencing a hospital overstay between October 2022 and September 2023. Broken down by medical overstays versus psychiatric overstays, there were 15 children experiencing overstays for medical reasons and 84 children experiencing overstays for psychiatric reasons. The average length of the overstay was 32.3 days for medical hospitalizations and 38.8 days compared to psychiatric reasons. I would note also that the averages vary depending by month, specifically for psychiatric overstays. In some months, the average is driven by a small number of individuals experiencing large overstays. DHS notes that overall, approximately 21% of total hospital overstays were less than 5 days in length. Comparatively to the data from the prior reporting period of October 2021 to September of 2022, the total number of children experiencing an overstay declined by approximately 24 in total. Exhibit number 13 on page 33 is providing data on the placement types following discharge for children who experienced inpatient medical and psychiatric hospitalization. There were a total of 355 children who experienced hospitalization during the current reporting period. However, there were a total of 608 placements after discharge due to some children who experienced multiple hospitalizations during the reporting period. Among placements after discharge, the most common were in residential or group home child care, as well as private treatment foster care. The following data in this section of the report comes from the annual out-of-home placement report that is issued by the Governor's Office of Crime Prevention, Youth and Victim Services on behalf of the agencies that are members of the Maryland Children's Cabinet. The first exhibit that's highlighted in this section is exhibit number 14 on page 34, which provides data on providers in Maryland. The 2023 annual report identified that in total there are 152 providers in Maryland. Compared to the total in the previous year, this equates to a decrease of 18 total providers. There were 170 total providers in 2022. As far as average capacity, the average capacity was 376.19 in calendar 2023 for state fiscal year 2023, which equates to a decrease in capacity of about 34.29. The remainder of this section of the report discusses data that GOCPYVS reported on actions taken by both the Maryland Department of Human Services, the Maryland Department of Health, and other child placing agencies pertaining to efforts to pursue expansion of resource development and closure of service gaps to address the overstay issue. The report identifies that DHS specifically engaged in weekly meetings with other child placing agencies and collaborated with other child placing agencies to address the placement of certain youth who were exhibiting high complex behavioral health needs that had difficulty achieving a timely placement. DHS also specifically created new positions focusing on serving as youth hospital liaisons and working directly with providers to focus on addressing some of these specific challenges. Lastly, DHS continues to work on implementing prevention services under the Family First Prevention Services Act in order to prevent the need for higher level services in some instances. The report by GOCPYVS also identifies some actions taken by the Maryland Department of Health, Behavioral Health Administration in collaboration with DHS and other agencies. Specifically, the report identifies that MDH work to expand bed capacity in some of the residential treatment care centers that it operates. Additionally, BHA has continued to work on Medicaid rate rebasing efforts for RTC providers that are funded through Medicaid, in addition to broader rate rebasing efforts by MDH and other agencies across child care providers. And BHA also engaged in other activities to seek to engage providers to increase capacity. These efforts will largely continue on in fiscal 2024 and including 2025. The final issue that's covered in the analysis is reporting findings that were covered in the Life After Welfare Report 2023 annual update. This report is issued annually by the University of Maryland School of Social Work to report on the outcomes for families after they leave the temporary cash assistance program. The 2023 annual report data broke down participants into 3 cohorts in order to compare participants leaving the program prior to the height of the COVID-19 pandemic between April 2020 and December 2021 during the height of the COVID-19 pandemic, as well as after the height of the COVID-19 pandemic. A key finding shown on page 37 in Exhibit 15 is that of the pandemic cohort, the families who exited TCA between April 2020 and 2021, about 56% of these families were first-time recipients of TCA benefits and participating in the TCA program, which is reflective of the widespread economic conditions and challenges brought about by the pandemic, which resulted in new and expanded families across Maryland reaching out for assistance through the TCA program. This finding is reflected in the following exhibits, Exhibit 16 and Exhibit 17 related to employment percentages before and after TCA participation and earnings before and after TCA participation. Exhibit 16 on 38 is showing the employment trends. So overall across TCA participants, generally the rate of employment is higher in the time period following TCA participation compared to prior to TCA participation. However, if you look at the breakdown between the cohorts for families who exited TCA during the pandemic, there was actually a 1% decrease in the rate of employment following participation compared to prior to participation, which is reflective of the ongoing challenges caused by the pandemic in achieving employment for families leaving during the pandemic. Exhibit 17 on the next page related to earnings. This is showing that for earnings overall, there's a similar trend where the earnings following participation in TCA are generally higher compared to prior to participation. However, within the pandemic cohort, there was a smaller dollar amount increase in earnings. The increase was about $1,139 compared to an increase of $1,579 for the cohort prior to the pandemic and $1,810 for the cohort prior to the pandemic. This is reflective of the nature of participants in TCA during the pandemic, which generally had higher earnings when entering the TCA due to their differing educational and employment and other demographic characteristics. Exhibit number 18 is showing the participation rate in other benefit programs in the year following a TCA exit. The report indicated that after exiting the TCA program, there's still a high participation rate, particularly in the SNAP program, due to low overall income earnings, even for families that remain employed following exit. This Exhibit 18 shows that overall there's about an 86% in SNAP participation in the year following TCA exit for TCA participants. This is also showing that of all families exiting TCA, about 16% return to the TCA program within 1 year after exit. Exhibit number 19 is showing additional details on returns to TCA by time length after exiting. So this is showing that although there's about a 16% return rate in the year following initial TCA exit, as the length of time goes on following exit, the likelihood of return decreases. Between 1 and 2 years, the decrease is to about 6%, and in 2.2 to 3 years, it decreases to 4%, and between 3 and 5 years after TCA exit, there's about a 5% return to TCA. That will conclude the presentation, and we can answer any questions at this time. Thank you.
Thank you. Thank you so much to DLS for this incredibly thorough analysis. Really appreciate all of your hard work and partnership. Do any of the subcommittee members have any questions for DLS? Okay. Oh, do you have one, Delegate?
I believe I do.
Okay.
Good afternoon, everyone. My mind is like totally going because it's so much. But it's my pleasure. Happy New Year to those I have not seen. It's a little weird to have one of my favorite people out there. Welcome home, sort of, kind of. But to my question, one, I do want to say this report is very thorough, and I'm always concerned about the life after welfare for our families. So I will probably take a much deeper dive in what happens to our families after that. But my question, I was writing down things. Okay, so I'm looking over the budget review, and so I'm looking at the OHEP. And my concern is around, we're hearing from a lot of members across our state about the significant issues with the low-income home energy program that is funded through DHS. And so are there any formal agreements with local agencies to administer OHEP?
Actually, Delegate, this question might be better answered by our
For
DHS panel that's coming on next.
Oh, okay.
Yeah.
I'm so ahead of the gun.
That's okay. Yeah, you're so ahead
I
of
was
the
so
curve.
enthralled with the whole, okay, no problem.
You're doing a great job. Thank you so
Absolutely.
much. If there are no other questions from colleagues, I do have one minor one for DLS, and then I'll probably end up following up with DHS about it. So on page 6 of your analysis, we've got a couple of numbers here for MD Think. So I saw that there's a deficiency appropriation of $72 million. And I just want clarification. That needs to be spent down before June, right?
Yes, that is a deficiency for fiscal 2024, so that would be spent before the end of the fiscal year.
Okay, got it. And then the appropriation request for FY25 for MD Think, that's 136-ish? Yes, okay, great. Thank you. Okay, seeing no further questions from our colleagues, appreciate the analysis by DLS, and we will now bring up our DHS team. Secretary Lopez, welcome to our subcommittee. Welcome back. I know we have the privilege of hearing from you and your team many times during session, but welcome for the first time we get to hear from you. And if you would like to introduce your panelists, you're welcome to, although one seems strangely familiar to this room. Thank you.
Thank you so much. Happy New Year, everybody. Happy session. Good afternoon, Chair Shetty, Vice Chair Jones, and members of the subcommittee. I'm Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We'd like to thank Governor Moore, Lieutenant Governor Miller, our colleagues at the Department of Budget and Management, and the budget committees for their continued support. We are grateful to the Department of Legislative Services team, especially our analyst Sam Quist, for his budget analysis and assistance leading up to today's meetings. Joining me at the table today are Principal Deputy Secretary Carnita White and our acting Chief Financial Officer, who none of you know, Carol Resnick. We also have senior members of our leadership team present in the room behind me here. Chief of Staff Webster Yee, Assistant Secretary for Policy Heather Zanoni, Director of the Anne Arundel County Department of Social Services Rachel McConaughey, Kevin Geiswhite, the Executive Director of the Child Support Administration, Augustin Intabagana Yamana, Acting Executive Director of the Family Investment Administration, Chief Performance Officer Colin Murphy, and our new Executive Director of the Social Services Administration, Dr. Aldra Studstill, whose first day of service to the people of Maryland began today. Kid you not. Even has his badge. At DHS, we empower every Marylander to reach their full potential by providing preventative and supportive services, economic assistance, and meaningful connections to workforce development and career opportunities. We are committed to unlocking opportunities for the over 1 million Marylanders we serve. We work in partnership with nearly 6,000 members of our team across all 24 local jurisdictions and departments of local social services. Together, we administer a $4.1 billion budget that is 73% federally funded. Governor Moore charged us to be fiscally responsible while prioritizing essential investments to rebuild Maryland's government. Using a data-driven approach, we are prioritizing our investments to help grow our economy in the long term and to better serve Marylanders. For far too long, there was a failure to make critical investments in DHS to truly make Maryland a place where we will leave no one behind. And to better understand where we're going, I'd like to focus on 3 key areas in the proposed budget this afternoon, specifically DHS's contributions to, number 1, ending childhood poverty, number 2, launching a new era of child welfare for the state of Maryland, and 3, reimagining MD Think. So specifically, let's start with ending childhood poverty and our contributions. I'd like to highlight a couple of our efforts in this year alone. Specifically, I'd like to start with reimbursement of stolen benefits. Pleas by Marylanders for help went unanswered for far too long in Maryland, and this administration is ensuring that the people we serve receive the benefits they need. We worked closely with the legislature, advocates, and victims of benefit theft to be the first state in the nation to create from scratch a simple, seamless, and swift way to replace over $19 million in stolen benefits to over 30,000 households as of this morning. We use data to drive our decision-making. Direct assistance to families is proven to lift people out of poverty, and families were denied that assistance by thieves. They deserve better than that. DHS is concerned that the federal government will not renew its stolen SNAP replacement program in the Farm Bill, and we work closely on behalf of the administration to meet with the members of the Maryland delegation to make clear Maryland's priority to make sure that the Farm Bill includes additional federal funding for the replacement of stolen benefits, as well as federal money to help states protect the benefits of people from not just the state of Maryland, but across the country. We are also working with the bill sponsors of last year's Senate Bill 2 and HB 502 to course correct and improve safeguards for Maryland's investments. That particular investment in benefit replacement also ties to an innovative way we're looking at summer SNAP. With your partnership, 500,000 children in Maryland will be fed every summer when they're not in school. By investing $9 million in state general funds for our share of program administration, Maryland will receive from the federal government $9 million for additional administrative costs and $60 million for food benefits. This investment is proposed in Governor Moore's budget as a $78 million investment in the children and families of Maryland. Together, we will help families feed their children in all 24 jurisdictions across Maryland beginning June of this year. When the state summer SNAP program launched in 2019, we served 3,923 children in 4 jurisdictions. During the summer of 2023, we served 90,571 children in 14 jurisdictions. The reason not all jurisdictions opted into summer SNAP is due to a lack of funds and bureaucratic barriers in the opt-in process. We believe that by innovatively and seamlessly implementing the new federal summer EBT program, we will help feed 500,000 children across Maryland in every single one of its jurisdictions, including the approximately 60% of eligible children who rely on free or reduced lunch but are not participating in SNAP. We look forward to further discussion with you, this committee, to explore our departmental HB 183 bill, and are happy to answer questions about that as well. We just presented on that yesterday. Now I'd like to turn your attention to what we're thinking about in terms of turning a new page and a new era in Maryland of child welfare, and specifically focusing on family by blood and by choice. The way in which young people choose their family isn't always by those to whom they are born, but specifically how we honor young people and honor our families to reimagine what we're doing in Maryland matters. And there's 4 areas I'd like to draw your attention to. Number 1, how we want to prevent unnecessary removals of children to begin with. Number 2, how we want to end aging out of care in Maryland. Number 3, how we want to create a kin-first culture in Maryland. And number 4, how we want to modernize rate reform. So first, let's talk about the Family First Prevention Services Act, which our analysts spoke of, and how we want to leverage this to prevent unnecessary removals from families in the first place and leverage federal money to do it effectively. So we are committed to providing family-centered, child-focused, community-based services that promote safety and child well-being that strengthen families. We will lead efforts to leverage additional federal funding to support innovative foster care prevention services for Marylanders. For many years, DHS did not draw down tens of millions of dollars in available federal funding to expand services for families in crisis. Early in our administration, we partnered with the Annie E. Casey Foundation and Casey Family Programs, two nationally renowned philanthropic organizations, to implement best practices to help us actually participate in the Federal Family First Prevention Services Act. In 2018, FFPSA, as it's known, authorized states to use federal uncapped entitlement funds for time-limited foster care prevention services. The goal of Family First is to prevent unnecessary foster care placements by proactively addressing the top 3 reasons children enter foster care in the first place across the country: substance use disorder, mental health, and the challenges of parenting. Maryland has not seized the day because DHS did not draw down a single penny of FFPSA dollars since it was enacted by federal law. Not $1. In addition, DHS could increase its Title IV foster care administrative revenues by $1 million per quarter or $4 million per year, while drawing down federal funds for innovative services that prevent foster care and keep Maryland families safely together. To draw down more federal funds, DHS will improve how we identify children who are eligible for federal 4E funds when out-of-home placements are in fact necessary. For example, in the most current information provided, there are 1,508 pending 4E determinations out of a total of 4,671 children in foster care at a particular moment in time. About 790 have been in process for more than a year and still pending. If just half of the pending determinations are completed, the federal share of our administrative costs in the state of Maryland would increase by 5+%. This is just the first step of what we think we can do to actually responsibly invest Maryland's taxpayers' dollars and leverage federal resources that have been left on the table previous to our administration. Second, I'd like to turn your attention to the issue of aging out in Maryland. Despite reducing entries into foster care over the last 10 years, 64% of older youth aged out of Maryland foster care for federal fiscal year 2021. The state fiscal year. Twice as many older youth aged out of foster care in Maryland as compared to the nation's data. In Maryland, teens are 40% less likely to reunify with family as compared to national data. And as we all know in this room and those watching us online, young people need connection to their family by blood or by choice to thrive, whether they're 18, 19, 20, or 21 years old when they age out of foster care in Maryland. Non-Hispanic African-American girls are disproportionately aging out of foster care in Maryland because African-American teen girls in this state enter foster care at higher rates and are less likely and less frequently to be reunified with family. That is simply unacceptable, and we must act with a new kind of urgency to remedy this issue. Implementing Family First is the first step to reducing the number of African-American teen girls entering care in the state of Maryland. The next step is to ensure that teens are placed with kin by creating a kin-first culture in the Department of Human Services, Social Services Administration. So I'd like to turn your attention to the third item I mentioned, which is creating a kin-first culture. When children cannot remain safely at home, both research and common sense tells us that out-of-home placements with kin, biological and chosen, is in a child's best interest. That's not a personal opinion or my professional opinion. It's actually grounded in science and data around the world. We must look at that science and data to make better decisions for the people of Maryland. Placement with kin increases stability. It results in better mental and physical health outcomes. It reduces the risk that foster youth will be trafficked and keeps children connected to family, community, and culture. By creating a kin-first culture, we seek to improve outcomes for children and families and reduce family separation. Currently, only 23% of all children in foster care in Maryland are placed with kin, which is a point in time matter for all children in care. Maryland has significant opportunities to increase kinship placements, improve support for kin families, and improve kinship guardianship permanency outcomes. Today, we are working with the chairs of the judicial committees in the legislature to bring our kin first proposals to the table for further consideration later this session. This builds on new federal rules about how nationally we must step up to the plate and really invest in kin across this country. Finally, I'd like to mention rate reform. DHS has unfortunately squandered many opportunities to modernize our regulatory framework well over a decade to create a continuum of care that better meets the needs of Maryland's families and children. And of all the things I heard coming into this role, I heard tons of complaints and criticisms of DHS and rate reform and very few solutions. And in less than a year, our team put together solutions. For more than a decade, Maryland has steadily and dramatically reduced the number of children in out-of-home care while protecting child safety. In fact, new entries are down 38% since fiscal year 2017. However, youth that do require out-of-home placements often present with more complex symptoms and clinical needs. With the corresponding national decline in group-based placements, we must be far more practical in how we actually use and leverage and partner with a statewide provider network to consider in-state treatment services for these youth, rather than sitting every couple of weeks at the Board of Public Works to answer questions about the millions of dollars we spend for a single child to leave the state of Maryland and be placed out of their homes. We can do far better earlier on to help preventing that to begin with. Maryland has experienced over a decade of failed attempts to reform its child placement provider rate setting to align with the actual cost of cares. Providers have these costs. They've asked for a partnership, and we are listening and we are responding. We want to provide them, the providers who actually work with kids every single day in the name of the state of Maryland, the flexibility for specialized services and capitalize on federal funding. This absolutely must change. And to give you an example of that, we did a whole bunch of research on this. With the implementation of rate reform, we project the opportunity to draw down at least $10.5 million in federal funding for direct care costs in the state of Maryland and $7.6 million in Medicaid reimbursement for clinical services. We've left that money on the table. We've been eligible for that money, and we did not act. The governor's budget proposes a $27 million investment in this reform effort, and as noted, it is likely to have a substantive positive impact on the lives of Maryland's children. DHS and our child-serving sister agencies, like the Department of Mental Health, Department of Social Services, Department of Health in general, will continue to work with the General Assembly on common sense and much-needed regulatory reform to ensure that we bring greater stability and transparency to our child welfare system. We are holding ourselves accountable to a new level of excellence in a much more public and transparent way. Now, finally, I'd like to turn your attention to MD Think. This is another one of the things that many of you have brought to our attention, and we've spent far more time on than we had thought a year ago. So MD Think is a shared technology platform that began in February of 2016 to supposedly modernize and integrate multiple state health and human service programs and applications. MD Think serves as a state's benefits platform to ensure Marylanders can access the help and services they need, such as health insurance and food. Since assuming office last year, we have been examining MD Think's operations, which has revealed significant issues. And I want to put them on the record, at least some of them. To put it simply, MD Think's applications have not been working as they should. That was the public posture, and that was simply not true. They haven't worked for our customers, and they haven't worked for our thousands of staff across the state who every day have to actually enter information into the applications. We want to say that out loud because in order to course correct, we have to actually own the truth about what we inherited and move forward. I've jokingly said that MD Think sometimes is like Voldemort, who shall not be named. And we are across the state saying to all of our people, we will name it, we will say it out loud, we will own it, and we will actually transform it for Marylanders. That's what we deserve. Working closely with my colleagues, Secretary of Health, Laura Herrera-Scott, and Secretary of the Department of Information Technology, Katie Savage, we found a lack of oversight across MD Think and financial overspend. No cost savings were achieved through federal fiscal year 2022, and MD Think has spent approximately $216 million more than anticipated on the MD Think platform to date. That was as of last fall. Upon discovering these issues, together with our colleagues across multiple agencies, we responded with immediacy and decisive action, including, but not limited to, key leadership changes to ensure responsible oversight of MD Think's daily operations, including the appointment of a new executive director, Pat McLaughlin, and rebuilding his leadership team. That is still a work in progress. We have reduced a projected budget shortfall in state fiscal year 2023 to less than $6 million. MD Think overspent in federal fiscal year 2022 by over $73 million. It took us an exhaustive examination to better understand that, and to better understand that, in fact, putting that together was an act in itself. We halted the creation of new development and application migration efforts to focus on existing applications, making sure the ones that we actually have work. We increased accountability around the authorization of new expenditures across our department, and specifically with MD Think, putting in new accountability measures. We require project budgets. Let me repeat that. We require project budgets and other basic administrative safeguards, including record keeping, which we did not find. We intentionally visited our team members in every single one of Maryland's 24 jurisdictions over the course of this last year, as well as to our customers who struggled to use MD Think's public-facing platform. We listened and we acted. Finally, similar to MD Think, we inherited a deeply broken department. And I'm happy to say that truthfully and on the record. A deeply siloed department that didn't work across administrations, divisions, and across all 24 of our local jurisdictions. And as our executive team leaders will say to you, I've repeatedly said, we are not 25 departments of human services, 24 locals and 1 central. We are one team. We are Team DHS, and that's the team Maryland deserves. Last year, by investing in our people, we decreased state job vacancies by 5.5%. Beginning on January 1st of 2023, we had a 15.20% vacancy rate, and by December 31st of 2023, we brought that down to 9.69%. That wasn't accidental. That was intentional, and it was a team effort across the state. And with the addition of new statewide customer call center in 2024, which is also included in the governor's proposed budget, we are determined to create a workplace culture where world-class customer service is the norm for Marylanders and the norm for DHS's reputation, because Marylanders deserve to be treated with the respect and dignity that they've always deserved. This budget proposal was assembled in partnership with many of you and others who advocate tirelessly for the Marylanders we serve. We are ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. I will now turn it over to our Acting Chief Financial Officer, Carol Resnick, to briefly summarize our responses to the DLS analysis.
Thank you, Mr. Secretary. Thank you to members of the HHS Subcommittee, HSS Subcommittee. Wow, even I just made that mistake, and I named the subcommittee. I'm now going to present the DHS's response to the various questions posed within the analysis. The first question referred to the decrease in the Montgomery County block grant of approximately $13.4 million. In 2022, during the planning process for the FY24 budget, the DHS made an error in providing Montgomery County an additional $4 million in FY23, $9.4 million in FY24. This was not intended to be an increase. This was meant to be an offset for an additional general funds and a decrease in federal funds. That decrease never occurred, and Montgomery County ended up spending the federal money. Upon realizing our error earlier in 23, we immediately sent Montgomery County a letter, which is provided for you in our testimony, that asked them to halt spending on the general funds, and that money was rescinded. So that error was fixed, and this budget proposal with the 13.4 cut returns the Montgomery County block grant to previous years prior to the FY23 error. I will point out that in correspondence with DLS, we initially determined that it was as a result of excess ARPA funds. That was an error on our part, so we apologize for the mistake, but we are correcting it here, and we're glad that further investigation allowed us to determine what happened prior to this administration taking office. With regard to the question about shifting TANF spending as a result of potential proposed rulemaking from ACF, the Administration of Children and Families, as was stated in the analysis, DHS strongly disagrees with any rule changing that would limit our ability to provide critical needs to helping families. At this time, the risk of the rule being implemented by the federal government is actually relatively low. Any rule that is perceived to reduce state flexibility or limit benefits in an election year will have significant political consequences, and any unpopular rule will likely be subjected to congressional review. Creating income security for families is an effective primary prevention strategy in avoiding child abuse and neglect, as poverty is a documented risk factor for abuse and neglect. As a result, stabilizing household incomes saves money in the long run. Utilizing resources for primary prevention strategies rather than treating an avoidable problem is the best course of action, and one that we would prefer to stick to. Because of these reasons, we believe that the risk to Maryland is limited, and shifting state resources away from needed programs at this time, with decreased revenues proposed in the budget to cover a potential shift in federal spending, may not materialize and would be imprudent. And to answer the third related question about what we believe the time frame would be for the rulemaking out of ACF, the federal government has obviously not provided a specific time frame for the implementation of the new rule, and as stated in the previous answer, we do not believe that that's going to be an imminent change. DHS commented on the proposed rules, and actually our letter to ACF is also attached in your testimony, that you can read our concerns and objections to that rulemaking process. We're hopeful that the key provisions in the proposed rule that we disagree with will be amended before any final rule is promulgated. Under Maryland State's plan, we provide TANF services to households with income levels up to 300% of the federal poverty line due to the high cost of living in the state of Maryland. Limiting TANF eligibility to 200% would impact cash assistance, but it would also limit other services, especially child welfare spending, transition benefits, and diversion programs. The potential federal limitation would require a significant allocation of general funds, an allocation that we are still working on trying to figure out and calculate, and to change state law by lowering that mandated 300% back down to 200%. There is no good option should that rule go into effect, and we are hopeful that when final rule is set, the changes that are proposed are not going to take effect. So with that, we are hopeful that as I said, that the rule change will not happen, but we do not anticipate that at least within the next fiscal year, we will have to deal with these changes, and therefore would not see a need to shift any general fund spending to federal funding. So with that, thank you so much, and we appreciate your time.
Thank you, Farrell. And now I'll turn it over to you, Chairwoman. Happy to answer any questions.
The button or not. Okay, thank you. Thank you. Thank you, Mr. Secretary. Thank you, former colleague and friend Resnick. Really appreciate you joining us. So I'm going to first ask if any of my colleagues have any questions. Delegate Asfero.
Thank you, Madam Chair. Good afternoon, Secretary Lopez. Very good to see you. Welcome, Deputy Secretary White. Appreciate your comments. A lot of what you said in your remarks certainly resonated with me, especially around our youth in foster care. I'm a huge proponent of direct cash assistance, both to low-income individuals and families, as well as to kids aging out of our foster care. I have legislation. I'm happy to discuss that with you. But my question, Secretary Lopez, is about TCN TDAP. Mm-hmm. I know since 2022, those who are eligible receive an additional or supplementary $45 to assist low-income families, and I think that's per household. Wanted to make sure that that is something that the department is going to continue to do for those that do need it, to include my constituents, particularly that extra 45 that certainly goes a long way. So if you could speak to that, again, appreciate all the work that you're doing, but yeah, just wanted to make sure that that supplementary direct cash assistance is something that's going to stay.
Sure. Thank you so much for the question, sir. So I would think that it'd be helpful to give a little bit of context that I tried to give in our opening remarks, which is that we're taking a close look under the hood on everything. I would argue that the way in which the department has been thinking about poverty reduction measures has been deeply siloed, and we're trying to actually course correct that to make sure that a family doesn't have to navigate our services and benefits, but in fact, we are proactively saying, oh, if you're eligible for this, you're probably eligible for these things. And I want to signal one thing in response to your question, which is that one of the things that Secretary Herrera, Scott, and I are doing with all of our teams is actually going to truly try to figure out in this next year how to have universal access to benefits, which we don't have in Maryland. So, for example, if you are a TCA recipient and your mom, and you have a one-year-old baby and you receive WIC, Medicaid, how do we make sure that you're eligible for all other benefits? So you can opt out versus opt in. There's fantastic literature nationally and worldwide around behavioral economics and helping people make those decisions and choices. So when I hear your question, I think about how do we help raise the bar for everyone around direct cash assistance. I will be honest with you in that the first thing we had to do in this year was course correct some of the most significant fires we were facing. Part of that was on the replacement of stolen benefits, so sort of that retrospective look, helping set the course for making sure that we're integrating our data and making sure we're being responsive, and also making some significant investments in this next budget year, which is, I would argue, a down payment and a multi-year approach to ending childhood poverty and ending poverty in general. So yes, we're happy to look at that with you. And what we're trying to do is reimagine how we do those kinds of very basic benefits, also trying to leverage as many federal dollars as possible.
Appreciate it. Thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, Mr. Secretary. Delegate McCaskill, you had a question earlier. Would you like to ask it now?
Thank you. Okay, so literally this presentation has sent me into a frenzy of research. However, back to my question again. For looking at the overview for OHEP, that we're hearing from members across the state about the significant issues with the low-income energy program that's funded by DHS. Mm-hmm. And so are there formal agreements with local agencies to administer OHEP?
Yes. The quick answer to your question is yes.
Okay.
I'm going to do one part of it. I'm going to turn over my esteemed colleague, Deputy Secretary Carnita White. The first part of it is very similar to the response here. We have been struck and stunned by the lack of coordination across all of the jurisdictions and central headquarters, right? One of the things we're doing is intentionally decreasing that division because of the way OHEP happens. I kid you not, in the last 24 hours, Carnita and I have been part of at least 2 emails, specifically responding, right? I kid you not. Every single day, we are personally intervening on making sure someone's energy, whether it's water or gas or light, is turned back on. Think about that for a second. Why must it take the secretary and the principal deputy secretary of the department to intervene on a basic fundamental issue, which we already have money for, which is to help you pay that bill? Literally, in the last, 6 hours, we were dealing with one particular case that we were stunned by. A mom whose energy was cut off and has 24 hours access to oxygen. But again, rather than taking a step back, which is what we're doing now, and saying, how might we streamline this across the state? It's been deeply siloed. We want a statewide approach for all Marylanders who are eligible for that benefit. And as of now, OHEP isn't fully integrated into MD Think. So if you are, I know it sounds crazy, if you're applying for services, why wouldn't that be one of the many options you had? So for example, if you're eligible for TCA or TDAP, as Delegate Acevedo mentioned, you would also be very likely qualifying for OHEP services. That kind of integration is not existing today in DHS. So I want to say that out loud, not because we want to blame anybody. That doesn't solve it. We actually have a solution for it. We're trying to get to that. It's going to take some time. One of those is strengthening those agreements with local jurisdictions and the various partners that administer the funds. 2 is making sure we could pay our bills on time. You would probably get an earload from my colleague here around how paper-driven our budget and finance process has been. Deeply paper-driven. That delays things. So I'm giving you sort of the arc of yes, directly, we have those agreements. No, they're not working as effectively as they can and should be. Yes, we're moving forward, and I want to have Carnita talk about some of the kinds of things she's been doing with FIA specifically to reimagine this work.
So, for the record, I'm Carnita White, Principal Deputy Secretary for Department of Human Services, Chairwoman and Co-Chairwoman. Nice to be here, and committee members. Thank you for having me. So, as the Secretary said, we inherited many challenges, or as we like to call them, gifts, And so as we are looking at these gifts, one of the things that we are proactively doing and have scheduled over the next few weeks are to go out to all of the local OHEP offices to really begin to talk with those staff there to see what some of the challenges are. So as we begin to course correct, we can hear directly from the staff, directly from the constituents in those jurisdictions. We have a mixture of how OHEP is administered now. So in some jurisdictions, it's done by the local Department of Social Services. In others, it's done by community nonprofit organizations. And so oftentimes that creates in itself differences because of the level of support that are available and access to other benefits. So if you work in a Department of Social Services, you can easily understand all of the other programs and make those connections. If you're a nonprofit, that's not as easy. So as the Secretary mentioned, how we streamline that, how we make it simple and seamless for our customers. Our customers should not have to navigate our systems in a way that it makes it more difficult for them. They should be able to apply for a benefit, and we should be able to issue that benefit to support them in their time of need. That is our mission. That is what we want to do, and that is what we plan to do as we move forward over these next few months to streamline this process.
Well, I thank you. That answered my question. I appreciate your boldness and your out-of-the-box and should have been already done thinking. We look forward to your course correction. Thank you. Thank you, Madam Chair.
Thank you, Delegate. I just want to sort of quick follow on to the delegates' good questions, just because, Mr. Secretary, it's been really refreshing to see the level of transparency and engagement. So thank you and your team for that. Especially related to customer service as being a key component to the work that you do. Many of the complaints and concerns that I hear are specifically related to customer service issues for people who are likely eligible, but we're similarly fielding calls about energy shutoffs. And so as you are working with the local agencies, just hope that you can ensure that those conversations include customer service agreements and requirements, and that you are strengthening that component of those contracts.
Absolutely, and we are so prepared to answer that for you. We
Awesome.
like to think about the questions that you might ask, and we are pleased as a team to talk about some progress we've made in one of the most difficult gifts we received. So week one, kid you not, we asked our team, how do we track daily complaints from customers across
On
Maryland?
OHEP or in
Oh
general?
yeah,
Okay.
in general.
On OHEP.
So
okay.
in general.
In general.
How do we, the State Department, track them? How do we know what we're being asked about? OHEP, TANF, TCA, child support? And the question was, we don't. The answer was, we don't. So we're going to put something in place. We're going to have to figure this out because we drown in data, right? All the agencies drown in data daily. It's what you do with it to extract it, especially by holding contractors accountable for performance. So beginning in the first few weeks of last year, we began to track every single day calls to the call center and calls to LDSSs. We asked our local Department of Social Services directors what they get. For example, Rachel's here right now. Arnitra was in that role before. They got 0. How can we as a state engage departments of social services in a statewide framework if we don't know what we're being asked to do, what we're being called up, and number 3, what the follow-up is? So we have transformed that. We track every single day how many calls and for what purpose. We track how many calls went answered and how many people were hung up on or disconnected. We track the top 3 issues, 3 to 5 every single day, and can actually track it across the state now. And every day send out to every single local Department of Social Services director 3 complaints that I've asked for. And the reason for that is because in order to build the culture that we are all accountable, that we are all in service to the people of Maryland, they have to know what it is. So for example, as of yesterday afternoon, we had a total of 6,620 calls to this particular call center. Of those, 6,503 were answered, only 117 were abandoned. That's a 1.8% abandon rate. That's a significant decline because what we are doing is holding ourselves and contractors accountable for answering the phones. One of our reputations. Yes,
sorry,
go ahead,
Mr. Secretary. You said 6,000 plus calls, but 500 were answered?
No, 6,620 calls to our center and 6,503 were answered.
Forgive me.
Okay.
I
No, you are experiencing what we experienced when we first started to track this. That number has steadily declined. And then, to your question, there are actually daily inquiries. So for example, for the Child Support Administration, we now know what percentage of calls were specifically around child support. And the question was, has a child support payment been made? Why would we expect Marylanders to have to wait on the phone to ask that basic question? That connects to MD Think, Customer Service Portal, that we can help our people engage with that. That's the kind of transformation we're trying to go. Similarly, for example, the check payment status, the question of how can I check payment information on my child support account? Some of these questions are about changing how we think as a department, how we engage people. For the Family Investment Administration, the top call yesterday of all those calls was a benefit question, and they asked, what is the status of my application or case? Is there people who need our help? Right? Similarly, there was one around medical assistance asking, how do I apply for health insurance? So by tracking data in a brand new way, by holding ourselves accountable, we also then, the senior leadership, does random calls. Carnitra will pick up the phone and follow up with someone, or look in and ask, why did it take so long? What can we learn from that constituent, that customer's email or call of concern to us? And that's something that's a new culture. It's not going to happen overnight, but to OHEP, to TSCA, whether it's to LIWAP, we have to be able to answer people's calls and to help them when they need it. This is leading in a new way that's tough, but absolutely worth the fight.
Okay, wonderful. And then are you able to provide some of that data to our subcommittee,
Sure.
Just so that we can have some of that? Thank you.
Sure, we track it daily, so we're happy to share anything we have with you, whatever you're interested in. We want to get to a place where we can do it by your actual individual
districts. Wow.
That's the vision, because when we walk into your office, we should be able to say, Chairwoman, here's what I've heard from your constituents. Here's how we followed up with your customers. We're going to get there soon, and we now, by sharing it with all 24 directors of Department of Social Services, we are pleased to see that they are taking on a very new way of leading and holding their teams in partnership and accountability, because none of this can be done by a single person. It's going to take a true statewide team effort.
Thank you very much. Madam Vice Chair, question.
Yes, thank you so much. I want to thank you all. I have to start off this presentation and the way that you have talked about what you have been able to do, identify, and see in the last year. I'm so very thankful for it. And I'm thankful for your acknowledgement of what you walked into and what you're trying to do, and your passion about ending childhood poverty, but also the advocacy for our children with the most promise, not the most disadvantaged,
Right.
Our children with the most promise who need the most advocacy, right? And that is the basis for what we should be led by. And so this is so close to my heart, and for which the home I was raised in and my grandparents and so forth. So your common sense, your streamlining, the sheer fact that I have constituents that have to be like red tape ninjas, right? I'm just so very appreciative. So, but that's not a question. So I need to just drill into, the agency shared that the budget includes $9 million to support the implementation of the new federal summer EBT program. And that amount would leverage $69 million in matching funds from the feds.
Yep.
Is that correct?
It is, and I'd love to talk about it if you want to hear about it. All right, so
Thank you.
And actually we learned some really important lessons from questions yesterday in committee. So first of all, though it's a new federal program, it's not a new program for Maryland. Your legislature, your colleagues, were ahead of the curve in the nation, and in 2019 passed a bill to launch Maryland's first ever summer SNAP program, which delivered a benefit. And when I was giving those data points around year one in 2019, serving 4 jurisdictions, serving a few thousand children, to 2023 with 14 jurisdictions and 90,000 children, the nation's advocates from Share Strength, the United States Department of Agriculture, listened to states like Maryland and developed a federal program to launch for the first time ever in the nation, a way to make sure kids get fed during the summer months. Why? Because they're not actually in schools receiving free or reduced breakfast and lunch. That's actually a really cool thing. To do that, they challenged states to put up a 50-50 match, which means that in order to run a program, we have to put in state general fund dollars to leverage additional federal dollars. So of the $9 million, we are repurposing an existing investment that Maryland has already made of $5 million. So we're taking and growing your initial vision, your initial commitment to feeding children across Maryland and skyrocketing it within a few months. So we'll go from 90,000 children in 14 jurisdictions as fed last summer to 500,000 children in all 24 jurisdictions with no local jurisdiction match. Why that matters is that one of the hurdles we heard from loud and clear was that some jurisdictions didn't have the additional resources, right? Whether it's the Western Maryland or on the shore or different parts of the central part of Maryland. And we want to make it easy for jurisdictions to partner. So what we're thinking about is those jurisdictions who might have resources to invest, we're going to be creative in how we look at maybe the December month, because December during the winter month is a month where the federal government program is not included. So yet again, modeling innovation. Why would we leave federal money on the table for Maryland for which our people are eligible? So $9 million in cash from the State General Fund draws down an additional $9 million from the federal government. That chunk runs the entire operation statewide and draws down $60 million in direct cash benefits across all 24 jurisdictions.
Thank you.
Sure.
Thank you for that thorough answer, and thank you, Madam Vice Chair, for the question. I just want to kind of follow on a little bit on that and emphasize that we're so grateful to be partners with you in this work. As you noted, this General Assembly has long prioritized this program. We care deeply about ensuring that our children are fed, especially during those summer months where they're not in school and they're not able to access meals that they otherwise would be getting. So just really grateful for your leadership in working on this. But I just want to echo my chairman's concern and his questions yesterday about some new funding requests that we're seeing because we've just not had enough conversations yet about how we're going to be paying for new things while we're shifting money around within our operating budget and our capital budget. And so it's not that we're not true partners with you. We're so grateful to be able to do that. But I just, again, want to ask, and I know we started the conversation yesterday in full committee during your bill hearing, but has DHS or the second floor agreed upon any ways that we could pay for this $9 million so that we can continue to expand this really important program?
Yes, thank you, Chairwoman, for the question. And so the quick answer is we are repurposing existing state general fund dollars to actually invest the $9 million. And that was a realignment of DHS's budget. And so ultimately, it's not new general fund money, it's just repurposed general fund money. And
but as you make those and forgive me, this is just my second year on appropriations, and so there's so many artful terms that have coded meanings, and I'm still learning all of them. But repurposing could also mean that you're shifting from programs that you've already invested in elsewhere within your department's budget, right? Like it's not, you have a pie and you have purposes for each of them, and repurposing could be meaning that you're taking something from one part and moving to another.
I guess the quick answer to your question is yes, but that's not what we're doing here. So for example, there were some questions asked yesterday that I won't repeat here, but as we did some homework on them, better understood that some of those aren't in our budget. And so, for example, there are some decisions the legislature will make in partnership with the governor around childcare.
Correct.
And that's a decision that you all get to make the governor.
Right.
As my job and our team's job is to deliver to the governor and to you the most fiscally responsible way of leveraging federal dollars.
Correct.
We believe that the investment of state general fund dollars of $9 million is well worth the $69 million we're going to get for a total of $78 million. And part of that is about reimagining how we're using our budget. So, there are tough choices. You are absolutely correct. There are decisions that you will all have to make about what you like or don't like. We are happy to be responsive to you, happy to give you whatever data you need to make that decision. And most importantly, as a member of the legislature, Chairwoman, one of the things that I've communicated to our leadership team multiple times in this, as we prepped for this new session, is 3 points that are worthy of repeating out loud. One, the governor charged us all on the cabinet to ensure that our teams are engaging you as our partners. That wasn't just words, that's intentional. We will engage you. That sounds crazy, but DHS hadn't done that. Number two, we will have an opinion based in science and fact and data. And whether we like it or not, we could disagree publicly, it's okay. But we want to give you an opinion. Similarly, we'll take a position, a yes, a no, or a neutral with intentionality. And that, we believe, is our job, to give you, as members of the legislature, the best information we can for you to make hard decisions as you review the governor's proposed budget. And we are happy to sit down with you, walk you through any of the data, walk you through the money, walk you through our logic, and provide any follow-up that you would like.
Thank you. Thank you, Mr. Secretary. You have been a wonderful partner to work with, and I'm very grateful for your leadership. And I agree, we do have some tough decisions to make, and we're grateful to have partners at the table to help make those decisions with us. I just want to just circle back my final question. I started asking this to DLS or analysts here who are just so tremendously talented. We're so lucky. But on page 6 of the DLS analysis, you all have requested a deficiency appropriation for MD Think, $72 million, and that has to be spent down by the end of June. And that is above and beyond the $130 million appropriated in FY24. So I know that, and we all know that it's a first-year budget, and you know what you know, and you don't know what you don't know.
That's right.
And so I'm just curious if you can share a little bit more about that $72 million deficiency appropriation. How are you planning to spend that down before the end of June?
Oh, yes.
And then if you can tell us a little bit also about your FY25 request, which is, I think, around $136 million. Is that going to be enough now that you know what you know, given that we had to appropriate 50% more as a deficiency appropriation for FY24?
Yeah. Those are all great questions, and I can answer them. Let me try to answer them as simply as I can, which is that first I want to say that when we think about MD Think, and we strip away even the words MD Think, what it really is, it's the state of Maryland's benefit system. I mean, nearly 7 million Marylanders use it for everything from birth and death records to access Medicaid. So making sure it can survive in a future form is really important. And one of the things we're doing as colleagues as we work with Pat McLaughlin is be really truthful about that road. And that road is going to take significant course correction. We're already on that path, as I mentioned, but I wanted to start there because the stakes are enormously high. Second, the issue of the appropriation. One of the things we did in digging deeply into the accounting practices of MD Think, and specifically DHS, who has served as the operator, quote unquote, of MD Think, even though it's in partnership with multiple sister agencies, is be able to create a clear, accountable path for all the dollars. Right now, if Pat McLaughlin walked in that door, we could walk you through every dollar, every contract, where it's being spent. It took us a year to get there. Now, that's faster than most often, but that kind of accountability did not exist. Third, on the issue of your question related to the appropriation deficiency, we found that deficiency, and it tied directly to the Agile contracts. There had been a multi-year Agile contract process put in place in partnership with the Department of Information Technology and Department of Social Services, and we wanted to make sure that we wouldn't have any drop-off between those contracts and fiscal years. That's what that money is for. We met with the staff of the Board of Public Works, the various secretaries and Department of General Services. I want to say it was 2 weeks ago when we walked through exactly the plan to make sure we have no drop-off in service, and that's what that money is for. Similarly, planning ahead to be able to rebid and recompete those contracts, to be much more transparent about how we're going to do that. And that's sort of both the answer to your immediate question of what we'll do between now and June, and then moving forward. So the Agile contracts is where it will go, and that will help keep MD Think, as of right now, based on our current analysis, on the path to recovery.
Okay, and then for the last part of the question, you've requested $136 million for FY25. Again, knowing now what you didn't know before for FY24, is that enough?
Our current analysis shows that it is.
Okay, and that includes like the potential $72 million in contracts.
Because in some ways we're doing retrospective and forward thinking in order to make up what I would argue is a lack of budgetary planning for the last couple of years.
Correct. Okay.
We think that together will get Maryland over this hump to a much different future. Okay. So changing the workforce, structuring the contracts with accountability, which weren't there, and this is important because it ties to the contracts. A little bit in the weeds, but worthy repeating publicly. The contracts that we inherited were not results-based contract on actually finishing an application. They were on staff hours. So we found that I could say to you, the Lopez firm billed you 1,000 hours at X dollars an hour. That's very different than saying the Lopez firm guarantees a CJAMS application that works, which, by the way, is a state system of record for all child welfare, juvenile, and adult services. That's a very different way of holding ourselves and contractors accountable. That's why when we did those estimates, we believed, again, not perfect, but we believe that the retrospective in terms of deficiencies and moving forward to your question will help us get us over this immediate finish line with a sense of urgency, and we will certainly come back to the governor and the legislature if that isn't enough, but we think right now it is.
Okay, so I appreciate that. So we are not likely to see a deficiency appropriation of this magnitude for next fiscal year.
Knock on wood, we better not.
Okay, okay, great.
And I mean, we literally, it was stunning. I mean, my colleagues here were part of the team. How many millions of dollars? So when I mentioned how much we were overspending, it was stunning to learn that. And you all didn't know that. We didn't know that as a department. And that's not okay. Hundreds of millions of dollars in overspending.
Got it. Okay. This is incredibly insightful. Really appreciate your transparency and the beginning of many discussions with you and your agency as we continue to examine the FY25 budget and dig deeper on that. Thank you so much for joining us today, and our subcommittee meeting is adjourned.
Thank you all.